the Central Massachusetts Respite Program is an outgrowth of the Central Massachusetts Partnership and developed through a unanimous agreement amongst all the participants in the Central Mass Partnership of the immense need for respite services, but the incredible frustration that was met by all participants in getting respite support people that met the needs of families. So families were had significant difficulties finding respite workers in the first place, let alone respite workers who had appropriate training and understanding of working with children and families. The agencies were not able to find staff members who even hired people to do this work. And so we developed the Central Massachusetts Respite Program as a way to really have a family-driven program that would train people specifically to work with families with children with special health care needs. The idea of going to local colleges was one that we borrowed from a program that was previously developed at Children's Hospital in Boston. That was a grant-funded program that trained medical students and graduate students to work with families. It was very successful, but like many projects that were funded by grants, fell apart when the grant funding ended, which was just 1 year. So our goal was to develop a program that partnered with enough community agencies such that after a while it would be self-sustaining.
I think it was essential to have a college that was committed and also already had a human service type major. So that was major, and also having an agency that has a proven and success rate in working with this population. And we were fortunate enough to have both of those, buy into the project and help sustain it.
We were very lucky to have various people in the Central Mass Partnership Program that worked for Seven Hills Foundation. We also had people who worked at Quinsigamond Community College and other community agencies that were willing to stand up and say, we're interested, let's do this work together, let's begin to develop a program.
We already had some of the training idea in mind. We knew where we wanted to go. We didn't know quite the colleges, but really it was a phone call from Jean Kennedy from Quinsigamond who said, I have this student. She's really interested in the respite project.
In the Human Services Department at Quinsigamond Community College, we really believe in community engagement. And students have to do a practicum, they have to do community service, and really get to understand how Worcester community provides services for individuals with needs. So when this project came to our attention, we were asked by the administration at Quinsig if we were interested in participating, and I said, let's look at that.
When we would have our meetings, it was very clear and obvious that a huge issue for families in the Central Mass region was respite care, and the members of the committee brainstormed month after month on how could we address an obvious need. Even when the economics are wonderful and people are making lots of money, I don't think this population ever doesn't need assistance. We needed to get a lot of stakeholders at the table and get buy-in from the different collaborating agencies. So first the group thought about who would that be. And it was very clear that collaborating with a local college, an agency that was already working with the developmentally disabled population would be key.
This program runs strictly on soft money, so grant support was critical to making sure that it could move forward. And we have one office that handles grants at Seven Hills, and that was sort of a continuing process of getting funded for those first 3 years.
My son had been pronounced dead at the scene of an accident and suffered severe brain injury. Major need for respite. As I found out early on, because his brain injury and the severity of his brain injury, they really didn't think that he would ever be at home, so it was considered that he would be in placement for the rest of his life. It was less than a year ago they said that he'd be in a vegetative state. There's no type of respite for our situation. He's an adult living at home and no services. But we don't really have any respite at all. and he's not in a program, so he's with me 24/7. Nothing. There's nothing. I've ventured to the State House to ask for services. I have found nothing. This is the most exciting project, and I hope that by this project they'll see the need for it, and it'll give awareness of what respite really means to families. No one knows, no one can imagine what it's like to have no supports at all. I hate the fact that I can't be a mother to either of my kids. I have to watch Dana 24/7. I have to monitor all his meds. I'm the case manager. And then my daughter, who keeps saying, "Mom, all I want is some mom and me time." And that's what I'm hoping once Albert is more accustomed and comfortable with Dana, because it's comfort level and trust level for both of them. But I hope to have a little bit more time with my daughter. And as my friends have said, they would just love to see me as a friend again.
Allison is a 24-and-a-half-week premature infant. It was a big surprise to us. She's a fighter. She has a lot of medical problems. It was a year before we found out she had cerebral palsy. She doesn't walk. She's in a wheelchair and getting heavier. I only work 1 day a week so I can stay home and take care of Allison. And she pretty much consumes the whole day with getting her up, changing her diapers, feeding her, giving her her formula, just all her basic care. And she also wants constant attention, so it's hard to get much of anything done. So respite is wonderful. I do feel like I'm stuck in a rut sometimes, and I appreciate my children more when I can get out and do something that I like to do. The insurance will only pay for so much, and there's a formula that they figure out to give you the number of hours, and it's not always based on the individual child, it's the task at hand, and that's unfortunate. My expectations actually are already filled to have someone that's dependable and helpful take care of Allison, that she enjoys and is happy with, and she's safe, and that really makes all the difference, knowing that she's safe and she's happy, and I can step back and do something else. The program is wonderful. I'm so glad to get the opportunity to try it and meet Tracy. She's a very lively and uplifting person.
Lillian was diagnosed with Rett syndrome in the fall of 2003, and we had quite a few difficult years with a lot of medical issues during that time. And we had no services at the time when Lillian got involved with Central Mass Respite Project. Equipment, prescriptions, a lot of new teachers for first IEP, all of those kind of things at the same time. And we really needed some help, and I had just applied for DDS, and the woman that was working with us said, "I have a great resource for you," and she referred us to the Central Mass Respite Project. So Lillian got to be the pilot child in the program, which was just a lifesaver for us at the time. Having a student intern was incredibly helpful, rather than picking out of a grand pool of people that we had no idea who they were. Primary benefit, I would say, probably is security. So having somebody that you know, that you've gotten to know, and that you feel is competent and qualified to watch a child with special needs.
Our needs for respite are limitless, really. It's exhausting having a kid with Rett syndrome. We're exhausted, and to have anybody come in, anybody more than we had family and everything and some friends, but every additional person coming in at that point in time was crucial. Me to go to work and Leslie to sleep during the day sometimes when she really needed to. Barely work, we could barely function as it was. So like I said before, any amount of help at that time was good. And like Leslie said, knowing that the people that were coming in were checked and experienced and trained and safe. The interns were great. I really liked them. Some more than others, like everything else, but for the most part, I'd say about 90% of the interns that came to help us were fantastic.
I really wanted to get in there. I didn't want to just be sitting in a classroom anymore. I feel you learn more if you're actually doing what they're teaching you. Plus, honestly, in a classroom they teach you the ideal environment. In real world, they don't have all the ideal environments, and it's a different kind of education. What direction I want to take my degree in, that's partly why I wanted to do this specific internship. Do I want to work directly with families? Do I want to work directly with a disabled child? What type of organizations will best fit me? When you go for a job interview, you're always worried, do you fit them? And at my age, I'm worried, do you fit me? So I picked Seven Hills because they fit me. My biggest concern is probably messing up. Isn't that everybody's? You know, you're concerned, okay, I'm just learning and I'm not an expert yet. Are they going to take everything I say as fact instead of a learning experience? What if I give them the wrong advice? What if they get mad at me? Boundary issues. And that's one of the things I'm actually hoping to learn with this program, is to really set those boundaries and deal with those boundary issues.
The students have provided a service, and the families have provided this experience, and it's just been this wonderful collaboration for the college, for the student, for I think our involvement with community agency. It's been wonderful. When I think about the benefits for students, significantly is that I'm going to say there's probably been about 7 students that have either been employed with an agency that works with individuals with children with special health care needs, or have continued to do the respite, and some of it through a state agency or human service agency, or privately, that families have decided to hire if they can do that.
We've seen such a tremendous commitment on behalf of students who weren't really sure that they wanted to get into this field. You know, they took the course at Quincy Community College, they enjoyed it, but they didn't have that agency experience. By bringing them into this, I think pretty much every student who went through the program has now decided that they want to, this is a career for them. They want to be in the direct service field of health and human services. That has been tremendous. If you can partner with a college or university, if you can partner with a community college, if you can develop that workforce stream, you're going to have talented, trained staff that you can hire. Families are going to be able to meet a need, and colleges are going to be able to create an internship that is robust and rich and really meaningful for the student. I would absolutely recommend to any agency to contact the CMRP for guidance and for technical assistance to help them get started.